जैसे वैद्य डॉक्टर अनुराधा नरवणे जो आयुर्वेदाचार्य है और उत्तम योग प्रशिक्षक भी है, हमारे आरोग्य भारती के राष्ट्रीय उपाध्यक्ष रहे हैं। वे प्रेसिडेंट ऑफ बॉम्बे सिटी काउंसिल फॉर चाइल्ड वेलफेयर मुंबई के प्रेसिडेंट भी है। वैसे ही वो आईएएस यूनिवर्सिटी के जो राजस्थान से बिलोंग करते हैं, वो आईएएस यूनिवर्सिटी के डायरेक्टर भी है। ऐसे महामहिम डॉक्टर अनुराधा नरवणे हमारे आज के कार्यक्रम के अध्यक्ष है। मैं उनका स्वागत करता हूं और उनसे विनती करता हूं कि इस कार्यक्रम के उद्घाटन पर दो हमें बोल सुनाएं।
नमस्कार। सबसे पहले आपका ये बहुत बड़ा जो ये आपने हाथ में लिया है, ये बहुत सुंदर विषय भी लिया है, और ये जो प्रोजेक्ट किया है जिस तरह से, वो बहुत प्रशंसनीय है। और आज के जो वक्ता है वो 100% बहुत अच्छा सुनाएंगे, तो हमें सुनने में ज्यादा अच्छा लगेगा। एक विशेष बात बताना चाहूंगी कि ये जो प्रचार प्रसार इसका जो हुआ क्षार सूत्र का, वो बीएचयू के देश पांडे जी थे। तो वो मैं बचपन में उनसे मिली हुई हूँ, क्योंकि मेरे दादाजी बीएचयू में प्रोफेसर थे और हेड ऑफ द डिपार्टमेंट थे। तो मालवीय जी के फिजिशियन भी थे। तो उन्होंने जो प्रचार प्रसार किया, उस हिसाब से सारा आयुर्वेद में तो पहले से पता ही था, लेकिन उसका प्रचार अधिक हुआ बीएचयू से। तो उसके लिए मैं आपको, ये जो आपने प्रोजेक्ट लिया है आयुर्वेद अभ्यसनम, उसका, तो उसके लिए आपको बहुत बहुत शुभेच्छाएं भी हैं। और इसी तरह से अन्य विषयों को भी लेकर आप आगे बढ़ते रहेंगे, और हमें भी उस नॉलेज का या ज्ञान का लाभ मिलता रहेगा। मैं अधिक समय नहीं लूंगी, क्योंकि ये आपने जो शुरुआत की है वो बहुत दिनों तक ऐसी चलती रहे, और नए नए विशेषज्ञों को लेकर आप ये कार्यक्रम चालू रखें। फिर से एक बार बहुत बहुत मुझे आपने ये जगह दी, इसलिए धन्यवाद। और आपके अगले कार्यक्रम के लिए भी बहुत बहुत शुभेच्छाएं। धन्यवाद।
धन्यवाद मैडम। अभी हम सभी गण धन्वंतरी प्रार्थना करके अपने कार्यक्रम की शुरुआत करेंगे। सभी से विनती है कि वो मन से धन्वंतरी प्रार्थना कहे। शंखं चक्रं जलौकां दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यांशुक परिविलसन् मौलिमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवनं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्। अभी आज के कार्यक्रम के जो प्रमुख प्रवक्ता है डॉक्टर हरिओम श्री एसपीएस नायर, इनका मैं स्वल्प परिचय आपको अवगत करा देता हूँ। क्षमा करें, एक मिनट। Dr. Hariaumshree SPS Nair is an accomplished Ayurveda physician, academician, and researcher with strong expertise in both clinical practice and teaching. He holds BAMS and MD Ayurveda qualification from the Department of Rasa Shastra Evam Bhaishajya Kalpana, and he is currently pursuing his PhD too. He is serving as an associate professor at Department of PG Studies in Rasa Shastra Evam Bhaishajya Kalpana at Shri Jayendra Saraswati Ayurveda College and Hospital, Chennai, Tamil Nadu. And he is also consultant physician associated with reputed hospitals including Kottakal Ayurveda Shala, Vaidyaratnam, Nagarjun Ayurveda Center, Chennai. Dr. Nair has made significant academic contribution of research and review articles published in various national and international index journals. He is also an author of a book on Churna Kalpana, focusing on its pharmacological and analytical aspects, highlighting its clinical relevance and pharmaceutical principles. He has actively presented papers at several national and international conferences covering themes such as digital health, pharmacovigilance, yoga, and Ayurveda, reflecting his interest in integrating classical Ayurvedic wisdom with his modern scientific and technological approaches. He is deeply committed to teaching, research, and evidence based Ayurvedic practices and continues to contribute to the academic and clinical advancement of Ayurveda. So, I welcome Dr. Nair and I request him to please start his session. Thank you very much.
Om Dhanandraya Namaha. So, I hope it is audible.
Yes, sir, sure.
Yeah, sure. Thank you. And thank you for this wonderful introduction. And I would like to thank first the team of Paschim Prant of Arogya Bharati for giving me a chance to deliver a topic under your organization. So, this topic which I am going to deal is about the Kshara Kalpana as well as the Kshara Sutra, the technique where the principle and its practice is being going on in Ayurveda. And I hope that it will be very much helpful and essential for both the undergraduate and postgraduate students of Ayurveda across India, because this topic is being dealt under both the aspect, that is in both the subjects, just like in second profession of BMS under the Rasa Shastra and Bhaishajya Kalpana, as well as in the final year curriculum of Shalya Tantra as well. Because this Kshara is one of the essential aspects, just like how Sushruta has said that as Shastra and Anushastra, Kshara comes one of the important aspect in dealing with all the treatment methodology. So with this, I would like to start my topic. And before that, I would like to share my PPT as well. I'll just share the same so that it will be helpful for everyone in this session who are attending. I hope it is visible for everyone, the PPT.
Yes, sir. Yes, sir.
Yeah, that's great. Okay, so here we're just starting the topic of Kshara Kalpana and Kshara Sutra, the principle to practice. And myself, as the introduction has given, I am Dr. Hariaumshree, an associate professor in Department of Shastra and Bhaishajya Kalpana. So first of all, let's go with the outcomes that we are going to see in this, because just like how the NCSM syllabus goes, the course outcome and the program outcome for this topic, I'll just like to mention briefly. So the first thing which we are going to see, it's about the Kshara Kalpana's fundamental principle, which includes its definition, the types, properties, and the classical references for the same. And followed by describing the preparation methods of Kshara. Because we know there are many types of Kshara, but out of which the preparation methods, how the preparation of Kshara is undergone. At the same time, it's including its processing techniques and the quality control aspect. And understanding the concept, because now we are going to see into the Kshara Sutra after completion of Kshara, its concept of understanding its indications and contraindication of Kshara Sutra therapy as per the classical text, and correlating the Ayurvedic principles with the recent advances in Kshara Sutra preparation. So this is what will be the course outcome of this topic, and what will be the program outcome. So program outcome, once the topic is finished, I hope that the session will have a good foundational Ayurvedic knowledge about understanding of the concept, definition, types, and properties of Kshara Kalpana as described in the classical Ayurvedic text, and understanding the pharmaceutical skills, that is stepwise method of preparation of Kshara, including its processing, storage, and quality consideration. When it comes to Kshara Sutra, understanding its concept is basic part and principles of Kshara Sutra, and its knowledge of indication, that is identifying the indications, contraindications, and therapeutic scope of Kshara Sutra with its recent advancement. So this is what the program outcome will be after the completion of this topic. So let's getting into the contents. So just in a brief way, I would just like to say that the contents that we are going to see in today's topic will be the Kshara in the beginning, its concept and pharmaceutical impact, followed by some classical examples. So based upon its standard operating procedures, that how it's going to be processed and its therapeutic utility we are going to see. Finally, the Kshara Sutra, that is its pharmaceutical impact and innovation aspect, we are just going to see in this topic. So let's start with the Nirukti. So Nirukti, so where we are going to see the Utpatti of this term of Kshara. So Kshara is generally as per Shabda Kalpadruma, it has been mentioned as Chara. Chara means to move. At the same time, as per Amarakosha, the reference has been given as Kacha. Kacha means to fasten, or we can even say as which is shining, something which shines. And Charam, Charam, it's actually a term where it is mentioned as ash. So these are some of the Utpatti of the term of Kshara. And derivation, as per Shabda Kalpadruma, it is Sharati iti Ksharaha. And as per Sushruta Sutra, it is Tatra Sharanat, Shananadva Sharaha. And definition given as per Charaka Chikitsa, it's Chitvaha Shaya, Sharaha, Sharatva, Sharayat Adaha. Okay. So these are the derivations of the Kshara Prayoga. So we're just seeing about the definition, just as we have seen the Nirukti, that is in Shabda Kalpadruma, where they have mentioned about Chara, which means to move. Whereas in Amarakosha, they have mentioned this word of Kacha. Kacha, the root word meaning to fasten. So immediately to impact. At the same time to shine. And Charam, as I have said, this word which is otherwise called as the ash. And as per Sushruta, we have seen the derivation which completely defines as Shana or Sharana, which means it destroys the fleshy mass, which will be unhealthy or maybe an unhealthy impact, because Kshara itself is having a penetrating property, as we have seen in the Nirukti itself, and which will be having a nature where the scrapping tendency will be there. That's why the term Sharana or Shana has been given. And Acharya Charaka also says almost the same sort of meaning, which means to scrape, that is to scrape an abnormal tissue from its location and destroying it after dissolving it, or considered as a corrosive nature. And Acharya Sushruta, just in the beginning, as I have said, that it is as superior in Shastra and Anushastra because of its incising, excising, and scraping action. So Lekhana, Chedana, and Bhedana action, and its Tridosha Hara property, where it has a good impact as per Acharya Sushruta has given. So these are some of the references from where we can get the reference about Kshara Kalpana from Shabda Kalpadruma, as I have said, and Amarakosha, Sushruta Sutra, 11th chapter, 4th shloka, it has been mentioned. Charaka Chikitsa, these are some of the Samhitas where the references can be seen. Even in Shastra textbook of Rasa Tarangani, Rasa Ratna Samuchaya, even in Nighantus like Bhava Prakasha, Raja Nigantu, Kayyadeva Nigantu, Dhanvantri Nigantu, and even in some of the textbooks like Bhaishajya Ratnavali, Ayurveda Sarasangraha, Sahasra Yoga. So these are all where we can see the reference of Kshara Prayoga has been given, or the term Kshara has been mentioned. And recently amended the Ayurvedic Formulary of India, that is AFI. There also we can see the modern correlation or the references given about Kshara Kalpana. So let's go with the Kshara Prakara. So we know that there are many types under the Kshara Udbhatti. So where we are going to see about, firstly, is about the source of raw materials. From the Kshara Prakara, according to the source of raw material, where we can see it is of three types: Pranija, Vanaspatija, and Khanija. So Pranija is something which is from animal origin. So here I have mentioned about Navasadra because in textbook it has been said that Navasadra is also considered to be an excreta of a camel. So that is why it is also considered. But other than that, there are Shukta and many other stuffs which is comes under the Pranija. Vanaspatija, we know that many herbal ingredients are there which even being used nowadays. So where like example of Apamarga, Kadali, Palasha. So these are some of the example of Vanaspatija, which is from the plant origin. And from mineral origin, obviously, there are like Suryakshara, Tankan, etc., from where we can get the Khanija origin of the Kshara. Next, about the Kshara Prakara according to the administration. So there are the different ways of administration given. So one is Paniya and another one is Pratisaraniya. So Paniya, it is by the term itself, we can consider that it is something which is to be taken in. So Paniya for internal medication. So in diseases like artificial poisoning or any sort of lump or tumor, in those conditions it can be given, or even in the condition of indigestion or even calculus condition. Whereas Pratisaraniya is something which is used for external application alone. So over the tumors, externally it can be applied. Even in arshas, that is piles, or bhagandhara, fistula nano, and even in Tvakvikaras, the Pratisaraniya type of Kshara can be administered. And according to its virya or potency, there are three, that is Mridu, Madhyama, and Tikshna. So these references are coming from the Sushruta Samhita, Kshara Paka Vidhi Adhyaya. We can see these out of the references. And it is one more consideration is based upon the Sankhya Bheda. So the number of Ksharas. So according to Acharyas, they have mentioned the Kshara as Kshara Dvaya, Kshara Traya, Kshara Panchaka, Kshara Shashtaka, Kshara Saptaka, Kshara Ashtaka, which is considered as Ashtava Kshara Varga, and Kshara Dashaka. And there is Kshara Eka, which is nothing but Sarjika Kshara, which they have mentioned. So these are all the Sankhya Veda. And as per different Acharyas has said about these different sorts of Kshara according to the Sankhya. So Kshara Dvaya generally is Sarjika and Yavakshara. According to different Acharyas like Rasa Tarangini, they have mentioned Bhava Prakasha, Yoga Ratnakara, and Raj Nigantu. Whereas Kshara Traya is Yavakshara, Swarjika Kshara, and Tankana Kshara, which they have mentioned. And when it comes to Kshara Panchaka, so totally by the term itself, we can understand there are 5. So according to different acharyas of like a textbook reference of Rasa Ratna Samuchaya, Yoga Ratnakara, even in Rasa Tarangani also, they have mentioned about Palasha, Mushkaka, then Yava, Swarjika, and Tila, which they have mentioned of Kshara Panchaka. When it comes to Kshara Shashtaka, it is according to Dhanvantari Nigantu, it is 6 types, that is Tila, Palasha, Vacha, Apamarga, Kutacha, and Mustaka. And Kshara Saptaka is according to Arka Prakasha, it has been mentioned as Swarjika, Yava, Tankana, and Suvarchika, then Palasha, Gauriya, and Mustaka. So these are all the different types of Kshara in Kshara Dvaya, Kshara Traya, Kshara Panchaka, Kshara Shashtaka, Kshara Saptaka. Next we are going to see about Kshara Ashtaka, which is of 8 types of Kshara which they have mentioned, like Snuhi, Palasha, Apamarga, Chincha, Arka, Tila, Swarjika, and Yava. So these are the 8 types, in which Rasarnava alone, we have mentioned that instead of Arka, it has mentioned about the Shigru, and Adraka also has been mentioned as Kshara Ashtaka. So according to different Acharyas, they have mentioned, but almost it is a similar, but some sort of changes is based upon the Shigru and Adraka as per the Rasarnava. Then Kshara Dashaka. So the 10 types of Kshara has been mentioned, which is nothing but the Shigru, Mulaka, Palasha, Kadali, and even Tila, Ardraka, Chincha, Ashwatha or Ikshu has been mentioned as an alternative, Apamarga, and Mochaka. So these are the Kshara. Dashaka mentioned according to the should be na ati tikshna, na ati mrudu, then na ati shuklata, then it should be slakshna. So slakshna, I guess everybody will be knowing that it will be something like smoothie, pichila, which will be slimy, and it should be abhishandi, and it will be shikra karita, that is immediately action, and Shiva, that is the pervading. So all pervading it will be. So these are some of the properties of a properly prepared Kshara. When it comes to improper, it will be Ati Mrudu, and it will be Ati Ushna and Ati Shweta. And at the same time, it will be Ati Tikshna, that is penetrating property will be more. Ati Pichila. So whichever we have seen as a proper, the opposite will be the improper one. So that's why it is Ati Pichila and Ati Visarpita, Ati Sandra, and it will be Apakwa in nature. And it will be of improper state, will be of Hina Dravya, prepared ones. And it will be Ati Tanu, very, very light in nature. So these are all the properties of Kshara according to Sushruta Samhita, it has been mentioned. And there are some other properties, like according to Charaka, it has been mentioned as Tikshna, Ushna, Laghu, Ruksha, Kleda. So moisture will be there. Dahana, Dharana, and Lekana, Deepana, and Chedana. So these are all the properties according to Charaka Samhita. Also, it has been mentioned for the Kshara. So now getting into the method of preparation of this Kshara. So this reference was taken from Rasa Tarangani. So where it has been mentioned like Kshara Vrikshasya Kashtani Dhagtva Bhutim Samaharet Vimale Bhajane Nasya Salilantu Chaturgunam Prakshipya Mardhyet Samyak Yama Matram Bhishadvaraha Triguni Krita Vastrane Sravet Salilam Tataha Sravitam Salilacha Atha Vahano Santapiye Tataha Nihishesham Salilam Nyatva Nirmala Sharam Haret. So this was the reference of Rasa Tarangani, in which actually we are going to see this into 5 steps. So starting with the Shoshana. So whichever plant we are just taking for the usage, the Panchangas, that is all its fruit, the stem, the bark, the root, fruit, everything will be collected all together. That is the Panchanga of the selected plant will be collected, and it will be dried under the hot sun. So by drying under the hot sun, it has been done. So that technique is called as Shoshana, followed by the Agni. So Agni means the dried plants will be undergoing the burning process. So it will be this dried plants will be cut into smaller pieces and it will burnt into ashes in a big wide mouth vessel. And later, once it is turned into ash, it will be allowed to cool, because once the Agni process has been completed. Then once it is cooled, it will be taken. So that process is called as Sthapana, where this ash will be measured. How much quantity of ash has been finally obtained, that will be measured. To that, as per the Shloka reference we have seen, Chaturgunam Salilam, that is 4 parts of water will be added into the vessel. It will be macerated and kept undisturbed for 1 whole night. So that's what the Sthapana process goes like. Then comes the Galana. Galana means the next day, as we have seen that it has to be macerated and kept undisturbed for overnight. Next day, it will be taken and the supernated liquid will be taken off, that is decanted, and it will be filtered through a triple folded cloth. That is what they have mentioned as Trigunikrit Vastrani. So in triple folded cloth, it will be filtered and then it will be collected. And that collected water will be allowed to go a process called as Agni, where the filtrate is boiled in another open large vessel with constant stirring and until it gets dried into a dry powder form. So that liquid portion will be evaporated by continuous heat. So this is what the final step of the Agni will be processed. So starting with Shoshana, next will be the Agni, that is the process of burning. The third step will be the Sthapana. Fourth one will be the Galana, that is the decanting and the filtration of the Kshara. Finally, this liquid will be burnt by completely evaporating the liquid portion and finally obtaining the dry powder form. And this is how the method of preparation will be happening. At the same time, this method of preparation will be happening and the season when the Kshara should be prepared. So generally the Kshara prepared in the Grishma Ritu, that is in the summer season, will be Uttama in nature, will be the best. And prepared during the Sharad, that is the autumn season, will be Madhyama in nature. And prepared in Varsha Kala, that is during the rainy season, it will be Adhama. Because in Varsha, as we have seen, it is having an hygroscopic nature, that is Kledana. So automatically it will attach the moisture content. So that's why we have to discard the ones which is prepared during the Varsha Kala. And generally the Shara won't be prepared during that particular season as well. So this is what the general method of preparation of Shara has been conveyed. And according to various opinions of preparation has been mentioned according to different acharyas. Sorry. So according to Sushruta, in Sushruta Samhita, it has been mentioned that the ratio of water will be 1:6. And just like as we have mentioned, the sthapana will be there, that is kept for overnight. Next day, it will be filtered in 21 times. So 21 times it will be filtered, and later it will be undergoing the process of boiling and obtaining the final powder. Same thing will be mentioned as per Yadavji Trikamji. 1:6 is the ratio. Whereas in Ayurveda Sara Sangra, it has been mentioned as 1:8. That is 8 times of water has been added to it, and it will be kept overnight for 2 to 3 days. And regularly the water will be changed and filtered with 4-fold cloth. And filtration will be done 7 times. So this is according to Ayurveda Sara Sangra. When it comes to Sharangara Samhita, it has been mentioned as 1:4. That is 4 times of water will be added, and it will be undergoing this process. And same thing, Ayurveda Prakasha as well has been mentioned. And same thing has been mentioned according to Rasa Tarangini, where it has been also mentioned that the filtration will be done with 3-fold cloth. So this is the various opinion of preparation according to different acharyas. So in that method, we have seen one method called the process of Galana. So under Galana, we have seen that there will be supernatant liquid which will be collected. So this liquid is considered as Shara Udaka. So that is also one of the important aspect where this in Shara preparation we would have been noted. So the clear supernatant liquid that is decanted after Galana is considered as the Shara Udaka. And this Shara Udaka can also be used therapeutically and in conditions of like depending upon its nature, that is Mridu, Madhyama and Tikshna Shara. So Mridu will be considered that this Shara Udaka will be subjected to boiling, and it will be obtaining as a dry powder form, which is considered as the Mridu Shara. Whereas this Shara Udaka during the process itself will be added. So once it has been boiled and obtained that dry powder along with the burned limestone and Shankha and Shukti. So this will be boiled and evaporated, and finally the obtained dry powder is considered as a Madhyama Shara. So the addition of this limestone, Shankha, Shukti and all will be around 1/10 of the total part of the drug ash will be added into it. Whereas in Tikshna Shara, this Shara Udaka will be added along with the limestone, Shankha, Shukti, and also fine powder of Danti. There are some dravyas like Danti, Dravanti, Chitratka, Langali, Putika and Hingu. So which we can say that many of these drugs are Ushna Virya Aushadhi. Along with that, Pravala and Lavanas like Bida Lavana and Savarchala Lavana. All together will be mixed, boiled and evaporated. And the finally obtained dry powder one will be considered as a Tikshna Shara. So this is how the Shara Udaka is given as therapeutically processed one in the form of a Mridu, Madhyama and Tikshna. And the mineral drug should be heated red hot and dipped 1/3 part of Shara Udaka several times until attains the fine powder. So this it will be generally for the mineral drugs, so which we are using like Shankha, Shukti and all. So it will be heated and then it will be used. So this mixture grounded well, and it will be added in a fine kalka form and put into a larger part of the Shara Udaka. So this is in the form of a mineral if we are adding anything into it. So this is the content where in the Kshara Kalpana itself we will be learning about the Shara Udaka, which is the clear supernatant liquid. Then once the Shara is prepared, how we have to understand its Paka Pariksha. So generally this Shara Paka Pariksha, according to Chakradatta in the Arshu Chikitsa Prakaranam, it has been mentioned that If Kshara burns the air and the Nala in 100 Matra Kala, it is considered as a Tikshna Kshara. So generally, we can't directly use it. So before using it as a Paka Pariksha, it has been given that the air and the Dala, it has been applied with Kshara and it has been allowed to burn. But if it is burnt within the air and the Nala in 100 Matra Kala, it is considered as Tikshna. Whereas if burns before the completion of 100 Matra Kala itself is considered as Ati Tikshna. And if it doesn't even show any burn in spite of counting 100 Matra Kala also, that is considered as Mridu. So this is how the Kshara Paka Pariksha has been explained under the Chakradatta Arsho Chikitsa Prakarana. And there are some characteristic features of this Kshara, as I have said, that it will be by touch. Once the powder is formed, it will be Shita Guna and it will be hygroscopic in nature. That is, immediately it will be absorbing the watery content, and it produces different taste when tasted. So different taste will be there when it has been tasted once the prepared Kshara has been done. And the Saviritavadi, or the shelf life of this prepared Kshara, can be happen up to 5 years. And the Anupana that can be given, so for internal purpose and all, it will be like Madhu or Jala. As we know that Kshara itself is a Mutrala, Dahakaraka and Lekhana in nature. And the Matra of this Kshara for internal administration can be done up to 2 to 8 Rati. So that is 1 Rati, we know that it is 125 mg. So here 2 to 8 Rati means around 250 to 1 gram. So 250 mg to 1 gram can be the dose of this Kshara. So this is one example where I am conveying about the preparation of Kshara. So here the example is based upon the Apamarga Kshara, where we can see the firstly the process of collecting of the drug, and once it is dried, it has been allowed to burn. So once the burn Apamarga has been taken, you can see in the C, image C, as ash of the Apamarga has been taken, and it is taken into a big wide mouth vessel. And it will be the water amount shall be added. So as we have seen, according to Sharandhara, it is 1:4. So according to different acharyas, it has been mentioned. So here the water will be added and it will be macerated and kept for soaking. Once it is kept for overnight, the next day morning it will be filtered. So we know that it has to be filtered for 21 types. So filtration has happened. In the image J, you can see the Kshara Udaka. That is a supernatant clear liquid. And this liquid will be allowed to boil. So boiling of Kshara Udaka will be happening. So in the initial state, we can see some white froth coming from this Kshara because of some of the substance that has been added into it. So automatically the frothiness will be there. And gradually, once the liquid part is evaporated, we can see that the froth changes to brown initially, and it will be considered into a semi-solid consistency. Then once repeated heating is happened, it will start to stick to the vessel. Then again we have to just keep on scraping. Then it will be obtaining into a color changed into a creamish, and finally you can see the white powderish one, which is considered as the Kshara has been obtained. So that is in the image R at the bottom last. So this is the process of the Kshara preparation from the beginning till then, from the collection of drug till the Kshara has been obtained. So these are all some of the method of preparation according to different Kshara of different classical examples like Sarjik Kshara, Yavak Kshara, Tankan Kshara, Surya Kshara. So this is a reference from Rasa Taragini. So these are all. So Panchankas of this Shudra Duralabha will be taken, and it will be, that is for Sarjik Kshara, it will be allowed to collect and dry and allowed to burn into a bhasma. And it will be mixed with the Ashtaguna Jala, macerated, and as we know that it has to be kept for overnight, next day it will be filtered and it will be allowed to heat. And the finally obtained Sarjik Kshara will be of Hima Kundendu Sankasha Sarjik Kshara. That will be fine white powdery form as per the reference it has been mentioned. When it comes to Yavak Kshara will be Panchanga of Yava collected, will be dried under hot sun, and it will be burnt to bhasma. And again, it will be mixed with 8 times of water, kept for overnight, and same process. In the end, you will be obtaining the Pandura Prabha. So the Varna itself, they have mentioned, it will be like Pandura Varna. When it comes to Tankana, so initially we have to go for the Nirmalikaranam of Tankana and followed by the Shodhana by 5 pala of Tankana. The Nirmala Tankana will be taken 5 pala Tankana in a white mouth vessel, iron vessel, and it will be given Agni. And the lastly obtained color will be Supushpita Nashtanira Shuddha Tankana. So this is what the reference has been mentioned for Tankana Kshara. And when it comes to Surya Kshara, again, we know that the Sora, so one part of the Surya Kshara will be taken with 24 parts of Soraka will be taken with 24 parts of water and allowed to Nirmalikarana. And you will be obtaining the Vimala Churna, Vimala Churna, Sankasha Soraka. And this Ashuddha Soraka will be allowed to Bhavana in Kalvayantra with Ela Toya for 3 times. And later it will be dried. So it will be formed into Suchurnita Shoraka Churna. And as per the reference, it has been mentioned that it will be Pandura and I hope that screen is visible, the PPT.
No, sir, not visible.
Okay, just a minute. I hope now it's visible.
Yes, sir.
Okay. So here we are seeing the Rasa Panchaka of the mentioned Ksharas. So for the Rasa of Sarjika, as we have seen, so all 4 will be like Katu Rasa, and Guna will be Ushna, Tikshna, Lagharuksha, and the Virya will be Ushna Virya, and Doshakna will be like Vatahara and Kapha Nashaka, and at the same time Kapha Vata Nashaka for Yavakshara, and the Kapha Vishleshaka for Vata Nashaka, and for Tankana Kshara, Surya Kshara will be Vata Kapha Nashaka. So this is what the Doshakna of each Kshara property will be given, and karma will be like Kledana, Pachana, Deepana, Chedana, and Krimigna for Sajik Kshara. And similarly for Yavakshara also almost the same with Mutrala and Hridaya. And Sweda Pravartaka for Yavakshara. This is one of the important karma. And Tankana Kshara, it will be again Hridyam, Balyam, and Pittakrit. Surya Kshara will be Deepana in nature. And the dose that can be given for each Kshara will be like Sajik Kshara with 3 to 12 rati. Same for Yavakshara, almost the same. And Tankana also the same, and Surya Kshara almost. So from between 3 to 10, maximum of 12 rati can be given. Anupana, as we have seen, the Jala, Madhu, these are the Anupanas that can be used, and along with that even Vasa, Swarasa, and even Guda can also be given as a Anupana for these Ksharas. So we have seen these are as the mineral origin, whereas when it comes to the herbal origins, so we have seen, so there are many such things. One is Apamarga, then Palasha, Tila, Snuhi, Mulaka, Arka, Vacha, Chitraka, and Mustaka. So we have seen, I guess most of them will be knowing the botanical name, and accordingly the Apamarga will be, so most of them will be having Ushna Viryam and Katu Vipakam, except Musta. So Musta is Cyprus rotundus, which is having the Virya as Shita Virya. And the karma will be almost like Kapha Vatahara, almost the Kapha will be almost the same for all the drugs. And there is some difference will be based upon its the Guna. So Guna will be like some Apamarga will be having Tikshna and Sara, whereas Palash is Lagu Sniktha. And similarly, for all these drugs like Snuhi will be Tikshna Sniktha, and similarly Arka will be Ruksha and Tikshna in nature. So these are all some of the gunas of the properties of herbal origin Ksharas once it has been prepared. Now getting into the, once it is prepared and it has been processed, so in which kind of condition it has to be prohibited to be given. So in this reference you can see, so contradiction indication can be seen that Dakshataha na ati upyunjit pipli shara lavanani. So this is a reference from Charaka Vimanasthana, where Acharya Charaka is not mentioning that the shara should not be given, but is always advised to be given. The medicine should not be given for a longer period of time. Instead, you have to always be in touch with a physician so as to get it confirmed and taken in a proper quantity. So this is one reference. And under Sutrasthanam, Sharapaka Vidhi Adhyayam of Sushruta, it has been mentioned that Ahitastu Rakta Pitta Jwara Atipitta Prakriti Bala Vritta Durbala Brahma Mada Murcha Timira Ityabhyo. So in these conditions, so Rakta Pitta, we know the condition how it will be, so bleeding disorders, and Jwara, so Jwara where the Pitta will be more in nature, so Pitta Prakriti person, then Bala, so for younger kids, Vritta for old age people, and Durbala who are weak in nature, Brahma, Madha, Murcha. So these are all the, we can say, the psychotic disorders, so where we should not be giving the Shara. Then this condition, it has been clearly mentioned that it has to be contraindicated. And even in different marmas like Marma, Sira, Snayu, Sandhi, Taruna Asti, Sevani, Damani, Galanabhi, Nakhantaha, Shefaha, Srotaha, Swalpa Mamseshu, Cha, Desheshu. So in these conditions, so if it has been affected, so Marma, Sira, Snayu, so in the veins, in the Marma Sthana, and Snayu, the tendons, if any sort of disorders has been happening, so in these areas, you should not be applying the Shara. Even in Vartmagata Roga also, it has to be carefully given. So that is what they have given. And in Swalpa Mamsa, where the Mamsa or the, we can say that the fleshy layer is very minimal. In these areas also, it has to be prohibited to be given. And the Shara Sadheshu Vyadeshu Shuna Gatram Asti Shulam. So in these conditions also, so Hridaya Sandhi Pidam. So in patient with heart disorders, so these conditions also, the Shara should not be given. So these are all the contraindicated areas where the Shara should not be given, or Shara application has been prohibited from use. And as this module is based upon the Rasa Shastra topic, so Shara usage in Rasa Shastra is basically, it plays a vital role in different pharmaceutical procedures like Shodhana, Jarana, Marana, and even in the properties where Shara itself has been acted as an antidote for some of the formulations. So in these areas also, the Rasa Shastra, where Kshara usage in Rasa Shastra has been given. And because of its alkalinity in nature, these substances help in corrosive or corrosion of unwanted materials from the desired product. And Kshara itself is having a cleansing property. So the Tankan, so borax, grouped under the Shodhaniya Gana, and is useful in preparation of metal extracts like Sattva also. And in 8th century, so in Rasendra Mangala, it has been described the general method of purification of all Rasa drugs, and for titration also with Shara, Sneha and Amla Dravyas. So that is also been mentioned under the Rasa Shastra. And in Rasa Shastra itself, for Shara for Rodhana, Murchana, Deepana, Niyamana, Uthapana. I guess this you would have heard about this Ashtadasha Samskara of Parada, where this Shara has been considered for the preparation or the Samskaras, for intending its to its increasing the potency of the mercury. And Tankana is again used in various methods of purification of the Parada as explained in Rasa Tarangi. So these are all the places where you can see the usage of Kshara in Rasa Shastra. And now getting into the analytical parameters of Kshara. So Kshara, what and all things we have to consider for the parameters, starting with its organoleptic characters. So like we know that its color, taste, odor and appearance is mandatory to be checked, followed by its physicochemical test. So physicochemical test or parameters where we have to see its determination of pH. So pH we have to mandatorily check for the alkaline nature of these Ksharas. Then the total ash, or we can say that ash value, and loss on drying, and at the same time the specific gravity and the refractive index can be seen. So these are all based upon the physicochemical test, and some of the qualitative and quantitative tests like sodium, potassium, carbonates and bicarbonates and alkalinity can be determined. So for the qualitative and quantitative assessment, and the modern parameters of chromatographic techniques can be used, and for the checking as it is an ash in nature, so it can be undergone with XRD, ICP and FTIR for the determining of analytical parameters, and also dispersion patterns can also be checked for the analytical parameters of Kshara Kalpana. So these are all the analytical procedures that can be used for the purpose of this Kshara once it has been prepared. So these are all some of the examples of Kshara preparation that is available in the market. So the Kshara Grita is there, Apamarga Kshara Taila, Shira Shatphala Grita, where Yavakshara has been added. Then Avitoladi Bhasma, which is from the reference of Sahasra Yoga. Vajrashara for Gulmadikara and Vajratnavali, it has been mentioned. Panaviraladi Bhasma from Sahasra Yoga. Kshara Parpati. Then Kshara Vasti has been indicated according to Chakradatta in Nirudhe Adhikara. And Kshara Sutra, obviously we all know, Chakradatta it has been referred. And Kshara Varti. So this is actually a research work which has been undergone, Kshara Varti. And according to AFI, the available sources are Apamarga Kshara, Kadali Kshara, Kalyana Kshara, Palasha Kshara, Mulaka, Yavakshara and all. These are all available examples of Kshara preparation according to AFI. So these are all the common examples of Kshara Kalpana and the Prayoga of Kshara. So which has been, many of them are available and many of them can be used for practically approachable and for treatment aspect as well. So with this topic, we have completed about the Kshara Kalpana. Now we are entering into the Kshara Sutra technique. So after the preparation of Kshara or all this preparation method and analytical process, what will be the next step that can be used? So as we have seen Pani and Pratisaraniya. So here we are going to see about the Kshara Sutra treatment. So starting with the definition. So what is Kshara Sutra? So Kshara Sutra, it is a medicated thread, which will be a thread which is of a linen of nature, and which will be of specified physical characteristics, and it will be a finished product quality by coating it with layers of materials obtained from the plants as mentioned. And Kshara Sutra, which we can say it is from two different words, Kshara and Sutra. Kshara, the one which we have prepared, and to it will be applying, so Kshara will be applied towards a Sutra. Sutra means a thread. Like this, the term of Kshara Sutra comes up. And Kshara we have seen, it is an alkaline salt, and Sutra is a thread. So Kshara Sutra is an alkaline medicated thread. So here in this image, you can see that thread of linen in nature. And once after the application of Kshara, how the color will be different, because there is many ingredients which will be added in this Kshara Sutra method, and the thread will be in such in nature. So before getting into this, so what is the historical review of this Kshara? So as Dr. Amaya Madam has said about this Kshara Sutra, which was firstly developed in Shalya Shalaka department of IMS BHU, that is Institute of Medical Science, Banaras in the University Varanasi, and later it was approved by ICMR. And in 1964 by Professor Dr. P.J. Deshpande sir, assisted by Dr. P.S. Shankaran sir and Dr. S.N. Pathak sir, were the ones who actually started this technique or firstly introduced this Kshara Sutra. And the first ever known published report was published in Nagarjuna in January 1965 with successfully cured patient of 10 people were being published as an article. And later, this role of Kshara Sutra in the treatment of Bhagandara, that is fistula and ano, where the first postgraduate thesis by Dr. K.R. Sharma sir, under the supervision of Professor Dr. P.J. Deshpande sir, submitted in the Department of Shalya Shalakya, BHU, Varanasi. So this was the first ever reference of Kshara Sutra in this modern terminologies which we are seeing. And the first exposure to the Kshara Sutra therapy at international level was a study of 200 cases in the American Journal of Proctology in the year February 1973. So this is the actual reference of Kshara Sutra, which was propounded and which was taken into practice in India and under the Department of Shalya Shalakya, under the guidance of Professor Dr. P.J. Deshpande sir. So who has introduced the Kshara Sutra. It is considered as the miracle of Ayurveda. And here we are seeing about this different method of preparation of Kshara Sutra. So this Kshara Sutra, obviously we need an ingredient called as linen thread, so which we have seen in the first image. So linen thread of 20 gauge, its size or its strength, and which should be of suitable length. And to it, what and all things should be taken. So one is Snuhi Shira. So Snuhi Shira is the botanical name is Euphorbia nerifolia, which is actually a Shira, and it will be collected in the form of a latex. And along with that, the Kshara. So Kshara, here we can, for an example, we can take like Apamaga Kshara, and also Haridra should be taken. And these three things should be applied over this linen thread, and then it will be allowed to dry and through UV radiation, and then it will be used for the processing technique. So this is how the method of preparation of Kshara Sutra has been conveyed. In the image, you can see how the Kshara Sutra has been done. So in the case of Arshas and even in the perianal abscess condition. So here in this image, you can see how the thread has been kept in that cabinet. So where the thread has been kept, and to it will be applying the Snuhi Shira. First, the thread will be attached to a string. Without direct contact, we'll be applying with the gloves to it with the Snuhi Shira, followed by the Kshara, and in the end with the Haridra Churna. So it will be undergone this process, and later it will be kept under the UV cabinet. So nowadays it should be UV cabinet. It should be kept so as to dry it up, and later it will be kept. In the first image, you can see that how it has been bottled and kept sterile. And this Kshara Sutra will be taken into practice for any sort of condition. So here in the first image, you can see the medicated surgical linen thread will be used in the anal fistula condition. So Kshara Sutra, how to tie up. And similarly, the second image, you can see that the Kshara being directly tied and being processed. And this Kshara Sutra application has been done over this condition. So this is an image which was done in National Institute of Ayurveda, where Dr. Hemant sir, who is the Department of Chaudhary in Shalya Tantra in NIA, has been done this process, and this image has been published in one of his articles. So this image was taken from that, and it has been given. So how the processing of this different sort of Kshara has been applied and done the process. So what should be the indication and the contraindication of this Kshara Sutra? So therapeutically, we know the indications of Kshara should be of like in the condition where Bhagandar or fistula and ano. Then in conditions like Nadi Vrana. So Nadi Vrana can be like, we can say that pilonidal sinuses, and even in Arshas, then Dushta Nadi Vrana, where the chronically infected or non-healing ulcers, it can be used. And in other Vranas, so ulcerative conditions, it can be used even in abscess, that is Vidrati, of different locations like pilonidal sinus, it has been given. Arbuda in tumors, which is externally protruded. So in those conditions also, this Kshara Sutra can be administered. Then in external growth of muscle and skin, that is called as Adimamsa. And also in gynecological condition also, it has been given, that is in Yoni, Arshas and all, vaginal polyps in the conditions therapeutically indicated for Kshara Sutra. And which and all conditions are the contraindicated? So the sinuses which are connected with the following lesions which are away from the anorectal canal shall be contraindicated. And in the condition where osteomyelitis of pelvic bones are there, or the osteomyelitis of femur. In those conditions, the Kshara Sutra should be avoided or contraindicated. And in TB cases, tuberculosis of hip joint or spine, in those conditions also it has to be avoided. Then in conditions like acute or chronic ulcerative colitis or appendicitis, in venereal diseases, Crohn's diseases. So in these conditions and all, the Kshara Sutra method should be contraindicated. So these are all the therapeutically indicated and contraindicated of Kshara Sutra method in the people. And here, according to Chakradatta Nadivrana, so the commonly contraindicated conditions where the treatment should not be done are, so Nishiddha Kshara Sutra Prayoga shall be like Krisha Durbala Bhiruna Gatir Marma Ashrita and Kshara Sutrena Tam Chindyana Shastrena Kadacha. So Kshara Sutra Prayoga should be avoided in patient who is Krisha Durbala. So Krisha who is lean, Durbala who is weak, Bhiruna who is fearful, so who is afraid. So in those conditions, people, it has to be avoided. And when it is Marma Ashrita, so any sort of Marma, if it has been hampered due to this any sort of sinus or abscess is there, in those conditions also the Kshara Sutra should be avoided. So these are all the according to Chakradatta. And even in the people, they have mentioned like pregnant ladies, acute infection or chronic, we have seen malignant disorders, and diabetes, which is of Pidaka, so we have to be very careful. Psychiatric disorders, so we know that it is somewhat related to Bhiru or conditions where it will be fearful in nature. And severe cardiac conditions. So cardiac condition, we know that they should not have much stress. So immediately if it is given and painful if it is there, so obviously the patient should be avoided of the contraindication of Kshara Sutra shall be given. And severe anemia, in those conditions also the Kshara Sutra technique or treatment shall be avoided. What are the advantages and benefits of Kshara Sutra therapy? So it has been given in one of the reputed article that it is a simple, safe and sure treatment for fistula and ano, where 95% of the cases are successful. So in fistula and ano cases, so Bhagandara condition, it has been successfully treated. And Kshara Sutra is a chemical fistulectomy, we can say, because it is of Kshara, rather than surgical fistulectomy. So it is not mentioned as surgical, it can be considered as chemical fistulectomy. And it is a simple, minimum invasive surgical technique. And the recurrence rate, once after the Kshara Sutra has been happened and the success rate is there, then again the recurrent is very minimal, it is negligible, around 3 to 5% of cases only. Chances are there with minor changes or issues will be there. And it is an easy technique which need not have to have a major OT, it can be even performed in minor OT condition. And there won't be any damage to the anal sphincters. And chances of incontinence is practically nil. And it is an ambulatory procedure where no hospitalization is required, just maybe in conditions where if it is severe, maybe a day will be required just to initially to just go for the thread change, and later we'll just go for the treatment aspect. And local anesthesia or topical anesthesia is the only one which is required. There is no requirement of any sort of antibiotics. And obviously Kshara Sutra is very safe in patients who are otherwise not fit for the surgery. So here they have mentioned like diabetes, cardiac patient and hypertension, which we have seen in the conditions where it has been contraindicated, but where there is minimally invasive if required can be suggested for Kshara Sutra. And again, it is cost effective than going for any sort of other treatment aspect. And it is a fully Ayurvedic management and associated medicines for internal and external use. And there will be minimum scar formation at the wound site, as it will be immediately healed and it will be cured. What are the recent advancement in Kshara Sutra? So there are some recent developments has happened in Kshara Sutra where we can see some of the recently prepared Kshara Sutra, like Udumbara Kshara Sutra is there, Papaya Sutra have been mentioned, Snuhi Swarasa Kshara Sutra, Yavak Kshara Sutra, and Kshara Sutra prepared from chloroform soluble extract of Snuhi latex. And at the same time, Ghrita Kumari Kshara Sutra has also been mentioned. Then Gandha Viroj Sutra has been mentioned, Tankana Kshara Sutra, Arogya Sutra, and Gugulu based Kshara Sutra. And some of the modified Kshara Sutra are also being explained, and it has been developed and is been practicing in some of the reputed institutions. And some of the references of articles about different sort of Kshara Sutra. So this is one article where we can see the improvement on Kanazava Sutra, which is actually a formulation based upon our Ayurvedic principles only, but it has been modulated in Japan. So Kanazava Sutra is actually a medicinal thread that is used for the treatment of anal fistula, and it is used as a substitute for Kshara Sutra in as we have mentioned, as we are practicing in India. And in this Kanazava Sutra, this actually they are using the some of the combinations of the capsicum. So capsicum, I guess many people will be knowing what is capsicum, and at the same time with the Acaranthus furui. So it is again a species of the Acaranthus. So Acaranthus aspera, as we have seen this Apamagashara. So these are all some of the combinations, and it has been used in Japan, is a substitute for Kshara Sutra, and is based upon the reference for Sri Lankan Kshara Sutra used in Ayurvedic medicine. So this is how this preparation has been done, and this preparation was done by prepared by Yoshimitsu. So he's a Japanese physician who actually prepared this Kanazava Sutra. So in Japan. So this is one of the article where our Kshara Sutra has been implicated in Japan as well. And there is another article where I have seen this, I have said about this recent advancement, where this Guglu-based Kshara Sutra in Bhagandra, where with or without partial fistulectomy has been comparatively clinical study has been happened. And there are some of the other journals where they have published about the review on various medicinal plants for the preparation of Kshara Sutra, as we have seen some of the medicinal plants in our references where we have said about the Rasa Panchaka. And similarly here also for Tridoshagna, Saumyata, Dahana, Lekhana properties, as we have seen these properties of Kshara. So these properties based medicinal plants has been used for the pharmacological and advancement of this Kshara Sutra technique. And similarly, for a comparative study of balanced rubber band ligation for Kshara Sutra has been also been practiced, which is a reference from IJA. And in journals of Ayurvedic research in Ayurvedic science, where the Kshara Sutra prepared through automated machine. The efficacy of Kshara Sutra prepared through automated machine and manual process in fistula and nano was done, which is a double-blind study. So, why this Kshara? The topic which I have taken for this class session, because we know that Kshara Karma can be implicated in many of the diseases. So as I mentioned, some of the notorious diseases, which doesn't mean that something which is major critically, but we can see that where the performance of surgery is also difficult. So where, there we can go, and at the same time where the lot of complications are there, like infection, disfigurement, difficulty to approach, or any sort of discomfort. In those conditions, this Kshara Karma is one of the essential aspect or essential treatment procedure which we can use for it. And this Kshara Karma, obviously it is a safe and an effective Ayurvedic procedure as a substitute for the surgical procedures. And Kshara offer a safe and effective Ayurvedic treatment to the patients who are suffering with especially the anorectal disorders. And Kshara Karma heals the anorectal diseases like Arshas or fissure or Bhagandar through complete natural and Ayurvedic procedures, which not only help to recover fast, but also very less chance of reoccurrence of the disorders. So this is why the main implications of me taking this topic and taking you this class about this Kshara Karma and Kshara Sutra, Kshara Kalpana Kshara Sutra, for everyone. So these are some of the references from where I have taken the topics and some of the articles which I have taken. And with this, I would like to wind up this session. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kashchit Dukha Bhavet, Om Shanti Shanti Shanti. So with this, I would like to wind up my topic of Kshara Sutra and Kshara Kalpana. So I hope that this session was helpful for everyone, and the class which I have taken was able to understand. And this topic which I was dealt, yes, obviously there will be some uh, topics which we can just go for this session. And because Kshara and Kshara Sutra is not a single topic where we can just finish off in a shorter time period, because it will need a class where practical approach is also an essential part. At the same time, the practical utility and therapeutic efficacy can be shared for the UG and PG scholars for an knowing this knowledge about this Kshara and Kshara Sutra. So thank you everyone for patient listening to my topic. So if you want to have any clarification, you can just let me know.
With all the participants to please share their queries in the chat box so that we can share our thoughts with our dear Dr. Nair sir. All participants, please share their thoughts or queries on the chat box. I think, sir, everyone has well understood this subject as you have taken them from text to clinic and from research to market. It was the lecture was in very simplified language so that each student can understand it better way. Today with us we do have our dear Secretary Dr. Santosh Gatne sir. I would like to request संतोष सर to please conclude this session. समापन के लिए मैं संतोष सर को संतोष डॉक्टर संतोष जी गटने सर को विनंती करता हूं कि वे अपने 2 शब्द व्यक्त करें.
सभी को नमस्कार. आज के आयुर्वेदा यसनम के इस व्याख्यान सत्र के व्याख्याता डॉक्टर नायर सर, मैं उनका हृदय तल से आभार व्यक्त करता हूं कि बहुत ही आसान शब्दों में उन्होंने क्षार सूत्र जैसे विषय को हम सबको समझाया है. यह जो लेक्चर है वो कुछ दिनों के बाद शायद हम सबको YouTube पर अवेलेबल भी होगा और ये बार बार सुनने लायक रहेगा. थोड़ा सा मैं प्रवास में हूँ इसलिए पूरा सुन नहीं पाया. इसके लिए मुझे थोड़ा खेद है. उसके लिए मैं उनसे और आप सबसे क्षमा भी चाहता हूँ. लेकिन जितना मैं सुन पाया उससे तो मैं धन्य हो गया. पूरे भारत भर में जिस मुख्य आजार रुग्ण रोग के लिए यह चिकित्सा की जाती है उसका परसेंटेज लगभग 40% बताया जाता है. कोई सर्वे ऐसे भी है जिसमें 75-75% भी बताया जाता है. तो 40 से लेकर कम का आंकड़ा भी पकड़ ले 40%. तो जो आज यहाँ यूजी वाले स्टूडेंट है, पीजी है, तो उन सब के लिए यह एक आह्वान है और एक प्रैक्टिस के लिए बहुत अच्छा चांस भी है कि इतनी गंभीर बीमारी है कि पूरी लोक संख्या में 40% इससे त्रस्त है. और आज की जो ग्लोबल मार्केट फोर्सेस है उनके हिसाब से तो ये आपके लिए एक चुनौती नहीं बल्कि एक सुसंधि है, ऐसा लोग सोचते हैं. लेकिन एक तरफ यह सुसंधि होते हुए भी दूसरी तरफ हम यह चुनौती है ऐसा सोच करके यह परसेंटेज जो 40% है वह अपनी चिकित्सा के द्वारा हम नीचे ला सकते हैं क्या कि हमारी पीढ़ियां जो काम करेगी 1, 2, 3 पीढ़ियां, तो ये शायद 10-20 साल में 40% से 10% तक आए. एक आयुर्वेद शास्त्र ऐसा शास्त्र है कि केवल उपचार के बारे में नहीं बताता है, तो यह अर्श के लिए जो भी हेतु है, संप्राप्ति है, इसका भी विचार किया जाता है. इसका भी उपचार के लिए हम सब विचार करें, अपने रुग्णों को अपने ज्ञान से ठीक करें, अच्छे करें, निरोगी बनाए. इस शुभेच्छा के साथ आज का मेरा कथन आपको धन्यवाद देते हुए मैं पूर्ण करता हूं. धन्यवाद.
धन्यवाद संतोष सर, बहुत बहुत धन्यवाद. ऐसा ही आपका हमें मार्गदर्शन मिलते रहे. अभी मैं सभी से विनंती करता हूं सभी पार्टिसिपेंट से कि हम अपने आज के कार्यक्रम की समापना शांति मंत्र से करेंगे। सभी से विनती है कि हमारे साथ शांति मंत्र का पठन करें। सर्वेत्र सुखिनः सन्तु, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। आयुर्वेद अभ्यसनम के सभी आयोजकों को, आज के वेबिनार सेशन के सभी पार्टिसिपेंट्स को मैं बहुत बहुत धन्यवाद देता हूँ ये प्लेटफॉर्म पर आने के लिए, और ऐसा ही आयोजन सभी का हमेशा होते रहे। और इस का अब हमारे अपने आयुर्वेद अभ्यसनम की जो भी जो हेतु है उसका प्रचार हो, प्रसार हो, ये सभी को शुभकामनाएं। और मैं आपको सभी को विनती करता हूँ कि ज्यादा से ज्यादा संख्या में अगली बार आप इसमें सहभागी हो।